Assalamu alaikum, everyone. Welcome to another episode of Ask Dent News. I am Dr. Sundar Saptakhar, and with me, I have Professor Dr. Abdul Samad Khan and our very special guest, Dr. Sarosh. So we're going to continue our discussion from where we left in the last episode. So there's a very pertinent point that you raised, funding.
Yes, that's
so,
I want to ask.
So this is something that all South Asian students, they really want to know about the funding process. So does your university have funding for international students? Because this podcast, we mostly cater to South Asian students. So they would be interested to know about the funding opportunities, if they should get funding from their respective governments, or such opportunities are available with Queen Mary as well.
Unfortunately, we don't have a lot of funding for overseas students. That includes anybody which is outside the UK or outside the EU. Even if there is funding available, it's in fact from Queen Mary itself. I don't think that there is any funding available which is for overseas students purely. But the way our students come in or overseas, they're either funded by their government. So if you're talking about Pakistan, they will be funded by HEC through their scheme, and they'll come to that. Or they will self-finance their PhD. But self-financing can be very challenging because again, it's a 4 years program, and the tuition fee can vary quite a bit depending on whether you're doing a clinical or non-clinical PhD.
Commonwealth scholarships are also not, like there is an option of Commonwealth scholarships.
Yes, Commonwealth. That's another one as well. Commonwealth scholarship as well. They can use. I think there's probably something from the British Council as well. I think so, which they can also apply for. So yeah, these are the streams which they can use. But again, it's always best to check with the supervisors, because sometimes they might have funding from other routes, which is not EPSRC or BPSRC. It might be some industrial funding, or they have some industrial collaboration, and in that case, they might be able to use that to fund the PhD, at least fully or partially, depending on how much funding they have. So again, it's very important to have that discussion with the supervisors right from the start about funding and if there is any options available. And sometimes universities might also run some schemes where they might open funding for overseas students, but that's where the supervisor then puts in the application. Again, they are very limited in terms of the number of seats which are available. Again, it's always best to have a chat with the supervisor and see what options are available.
And sometimes I suppose it is also evident on your on supervisor's profile. When you go to their website profile, they do it, and then this supervisor has funding for this particular project. So I think that would be helpful as well.
I mean, all the funded PhDs from UK are going to be advertised on jobs.ac.uk. So that's where they need to go and look up. Maybe over there, some might say that they are able to accept overseas students. So it's very good idea to go and search on the website and see what options are available, what funded PhDs are advertised there, and which of these are able to accept overseas students.
Right. Okay. So other than PhD, like like UK, they are also offering D.Clin Dent and M.Clin Dent programs. So like especially in Queen Mary, I think they are offering in all clinical subjects, if I'm not wrong.
Yes, so Queen Mary doesn't do, if you're talking about D.Clin Dent, so D.Clin Dent is what we're doing at the moment. So Queen Mary doesn't do M.Clin Dents anymore. It's all D.Clin Dent. And D.Clin Dents, which stands for Doctor of Clinical Dentistry or Doctorate of Clinical Dentistry, these are what we call as level 8 programs. So an MSc is a level 7 program in terms of its grading PhD is level 8, so D.Clin Dent is in essence equivalent to a PhD. It's also a level 8 program. And the D.Clin Dents that we offer are in perio, prosto, orthodontics, I think endodontics as well, oral surgery. So if you go on the Queen Mary website, it will list all these sort of main areas in which we also offer in oral medicine, oral microbiology as well, the clinical oral medicine, clinical oral microbiology. So these are the areas where D.Clin dents are offered. The D.Clin dents are 3 years program, and they are directed towards more experienced dentists. So you won't be eligible to apply for these soon after doing a BTS. You need to have at least 2 years or 3 years experience in that relevant area before you actually apply for these programs. So say if you want to do a pediatric dentistry, you need to demonstrate some degree of clinical experience in that when you apply for that. So there is an application process. After that, there is an interview. And then again, because we've got very limited seats, so I think depending on which program you're applying for, it's about 4 or 5 students they can maximum take, because obviously it's a clinical degree, so they need to work on the clinics, or so there is a chair commitment to that. So that's why it's a limited number of students. So it's very, very competitive. So at the interview as well, the discussion is going to be more around the clinical experience. It was going to be a very sort of extensive interview. They'll ask about your clinical background. They might even show you some clinical pictures or images and try to assess your clinical understanding or discuss with you treatment planning, things like that, because they don't want to get somebody and then realize that, you know, the student is not capable of doing that. So it's a very, very competitive degree, the D.Clin dent. The MSCs are 1 year programs, so they are level 7. And also, sorry, I forgot to mention the D.Clin dent, you've got clinical work as well as you need to do a research project as part of that. And the research project is then for that 3 years duration. And at the end, you need to do a presentation and a viva. So you're assessed on both your research as well as your clinical knowledge there. The MSCs are level 7. They are 1 year programs and they have a taught component. So these are taught modules and you also have a research project. You need to do all that in 1 year time. Now in an MSc, you will be assessed about your research knowledge, but you're not assessed on your research project or the quality of your research project, because that's something which is done at a level 8, because level 8 is knowledge creation. So that's where you assess a PhD. So when you do a PhD viva, you're not just being assessed on your knowledge, but you're also assessing the PhD and the quality of that PhD project. Whereas in an MSc, you're just assessing the understanding of that student of that project, because at that level, you don't expect them to have a novel research project. Whereas in PhD and D.Clin dent, the research project has to be novel. It can't be something which has already been done before.
So in order to apply for D.Clin dent, do international students have to clear their ORE before applying?
No.
Okay.
So they don't need to do it their ORE, because once they get accepted, they will get temporary registration with the GDC where they can work on the clinic supervised. So they can work under supervision as part of, so they don't need to do an ORE to apply. They can do an ORE if they want to. I mean, there's nothing stopped, but it's not a requirement.
So after D.Clin dent, they are eligible to practice in UK?
No. To practice in the UK independently, they have to take ORE. Okay. That's the only route to practice in the UK.
Thank you so much, Dr. Sarosh, for your valuable insights. And we're going to continue this discussion in the next episode. So until then, Allah Hafiz.